Good morning. My name is Martin Walsh, and I will be completing the Module 4 pharmacology assignment. And today will be a video. I'm going to actually break this in two videos because I tend to talk a lot when I get excited. And yeah, I figured it'd be a lot easier to upload and download. So this first part will be our scenario-based questions. In our scenario, we see a obviously confused older woman, 54-year-old female patient brought in by the EMS, and she has her hands are shaking severely, shouting at the doctors and nurses, and she needs a bottle. She's dirty, and you can smell the body odor and urine, so poor hygiene. And was wandering in a park, so she could be lost or something. And you might keep seeing me glance. I made notes so I could reference. But our first critical thinking question is based on our first impression. Based on their actions and appearance, what do you suspect she's suffering from? And I actually came up with three separate things. First one, you can't help but know, see when she asks for a bottle, you think alcohol. So we're thinking alcohol or drug or combination of the two and the withdrawal symptoms. My second theory was hypoglycemia, because in in severe cases, you can have confusion, delirium, uh, irritability, hostileness, stuff like that. So, hypoglycemia is something that most people don't understand or know, but you can basically look like you are wildly intoxicated and losing your mind. And another one is schizophrenia, complicated by substance abuse of drugs or alcohol. Um, so those were my first three impressions. Um, so moving on, short and long, and I'm gonna give my reasons for those in question number three. I figured that'd be the best way to explain it. So question number two is, what short and long-term health risks would you suspect this patient faces? So short-term risks, and these first couple will apply to every, um, scenario that I, foresaw. But first one is obviously the hygiene issues. Smelling of urine. I mean, she's, wetting herself, so it could easily develop a UTI. Um, she can, because she's not cleaning herself regularly, and she has all the body odor and whatnot, risk for bacterial skin infections like cellulitis become very prevalent, and that is an issue that you know whether you're hypoglycemic or schizophrenic, and or you're having alcohol drugs, withdrawal. If you're indigent and you can't, bathe, then possibilities of skin infections rise dramatically. Another one is, starvation, uh, anorexia, not by, design, but forcibly by your circumstances, and nutrition deficiencies. And that's just basically, uh, obviously, when you're looking at like a schizophrenic, if they're extremely, uh, you know, affected by it, they won't be able to care for themselves to know enough they need to eat properly. Uh, Severe users will neglect or forego uh, food in order to focus on the drug. And then a lot of drugs actually, it'll take away the hunger, and it'll make you not want to eat, or make you sick to eat. So you could really do a lot of damage there. Um, and then when we're talking about the hypoglycemia, the symptoms, you're gonna have uh, a this one. I got this one from our Mayo Clinic, so I'm not exactly sure how to cite it in our video, but this is where I'm getting this one. This is our Mayo Clinic source. You could have the fast or irregular heartbeat, fatigue, pale skin, shakiness, anxiety, sweating, hunger, irritability, tingling or numbness. And those are just the light term, the light hypoglycemic symptoms. As it gets worse, you're going to be seeing confusion, abnormal behavior, uh, visual disturbances like blurred vision, seizures, and the loss of consciousness. Long-term risks. So, whether it is drug or alcohol withdrawal syndrome, schizophrenia complicated by substance abuse, hypoglycemia, if it's a substance abuse issue, you can be looking at addiction, and then addiction withdrawal syndrome symptoms, and then you know, like I had already said, delirium, depression, anxiety, uh, and then it can go as far as coma, death, because your body relies on all of its symptoms functioning properly. So why do you think patients' hands are shaking, and what do you think causes their confusion and combativeness? So with the drug or alcohol symptom, uh, that I see as a very telltale sign of an extremely chronic alcohol user. Um, the confusion and combativeness will, and that can come off of drugs as well. But with alcohol, the DTs, the delirium tremors or whatever, tremens, delirium tremens, if I'm saying that right. Um, which I got this source on WebMD. But they can the symptoms of the DTs can include tremors, chest pain, confusion, deep sleep that lasts longer than lasts for days, dehydration, excitability or anger, fever, uh, hallucinations. Let's see, nausea, vomiting, nightmares, other tremors, passing out, problems with eye muscle and movement, seizures, hyperactivity, sleepiness, stupor, or fatigue. And yeah, that's my thoughts there. The hypoglycemia, again, is the same thing. Uh, the the initial signs and symptoms, fatigue, shakiness, anxiety, irritability, numbness of the lips, tongue, or cheek, hunger. But as it worsens, again, we see confusion, abnormal behavior, or both, the inability to complete routine tasks, visual disturbances such as blurred vision, seizures, loss of consciousness. And then with schizophrenia, that goes back to I said schizophrenia complicated by substance abuse, only in that the shaking of the hands, that could be the withdrawal symptoms from alcohol, which is also going to exacerbate the schizophrenic nature, which again, this is another source from Mayo Clinic. But you're going to have the delusions, hallucinations, disorganized thinking, disorganized or abnormal motor behavior, and other like negative symptoms, and that can cause their confusion and combativeness as well. And finally, what assessments I think are needed? So upon intake, we're going to see a mental. Well, first off of intake, we'll do just a general health assessment, top to bottom. Make sure there's no active, infections in the skin that we can see. We'll run our labs, so we're going to want the CBC, and we'll do a CMP, the complete metabolic panel, for we can check for our sugar levels. We can check liver and kidney functions to also see, like, make sure we're producing the proper amounts of insulin, and that will be able to rule out any um, organ issue that could cause a hypoglycemic incident. And then we can also run a tox screen for any substance abuse issues or alcohol. And yeah, so the CBC will also let us know other infections, because, like I said, the bright red burning area, the cellulitis, that's going to be a lot more visible and obvious to physician during an initial assessment, whereas a UTI, might be a little bit harder to detect. So that's that. An elevated white blood count will definitely signal us some red flags. And once that intake assessment has been done, the very next step should be have a psychologist come over and check them out, give them a basic mental health assessment as well, and determine if any inpatient treatment's needed. So, as you can see, I'm already at 11 minutes and I'm only halfway done. So, I'm going to stop this here, and then I will begin number 2. Thank you.